I had a vision of a pediatric practice that was not like the pediatric practices that I had been associated with before, in terms of patient care, the way we treat patients and parents especially, and I felt that I could not affect change where I was. So that motivated me to start my own practice, which was pretty risky at this point. I like the fact that I set my own limits. I set the rules for my practice in terms of how patients and families are treated, which is, again, very different from the way things were in my other practices. That's what I like about it, is that I can set the limits. Chelsea Pediatrics is an unusual practice. It is run by a nurse practitioner. It's the only pediatric nurse practitioner practice in Orange County, so we're breaking new ground here. I have a collaborating physician, as all nurse practitioners do. He's not here. He's in Rockland County. I think I treat every patient individually. You're not one of many. It's not a cow call. We're very flexible here in terms of illness, immunizations. I am strongly an advocate of immunizations. If you choose to be a little more flexible with them, I will work with you. As long as those babies get immunizations, I'm there for you. Lots of information, lots of education. Nurse practitioners do a lot of teaching, and I think that's where we differ with many physicians' offices, pediatric physicians' offices. Lots of teaching. I can write any prescription that the pediatrician can. I can examine and diagnose the most simple and sometimes complicated illnesses. What I cannot handle, I will refer to a specialist, the same as a pediatrician would, or a family practice physician would. Good morning. Welcome to Chelsea Pediatrics, nurse practitioner.
It's a great office you have.
Thank you. This is a family affair. Everything here is done by my family. The painting is done by my sister-in-law and my niece. My niece who works for Sesame Street Workshop. And this is my idea of a pediatric office in terms of, this is my vision. This is my teaching wall. And this encompasses children from birth to teenagers. I have information over here for teenagers and babies, mostly for parents here. This is an up-to-date parent corner. I try to keep it up-to-date in terms of questions about vaccines, immunizations, seatbelts, car seats, diet and exercise, hand washing. This is obviously focused for the children. The H1N1. The school checklist. When do I send my children to school? What do I do if I have a fever? So these are kind of current issues, and this changes constantly. This always stays here. This is my medicine cabinet essentials and my poison prevention tips. So this is constant for parents. Interesting. This study here. Little tidbits that I take out of the newspaper. HPV vaccines, encouraging parents to vaccinate their children. So again, this is my teaching wall, and it's constantly added to. It's not static. It is not static at all. And that is my logo, my little bunny on a skateboard, which is also up there. My son volunteered his skateboard and his bunny. He also volunteered his kite, which hangs there. Again, a pediatric office unlike anything I've ever seen, and I've been in quite a few of them.